much more common.
Mandy, mild traumatic brain injury. I take it many of those don't go diagnosed. Would you expect those figures to be much higher than the 3.2%?
Yes, I would actually. And the piece of research that Professor Green has just alluded to there, when we look at the groups that we used within this piece of research, and the piece of research we're alluding to is 2012 Rona, which was quoted in the last Select Committee debate. The actual sample groups that they have used in this research were not relevant, were not TBI cases. So they were people with alcohol or drug misuse, and they were just random samples that were taken. So those figures, I believe, are actually skewed, and that is not a correct representation, as Professor Green has said as well, because they do not include people equally that were casevac on the scene, that would have equally have had not just severe or moderate, but would have had a mild traumatic brain injury as well. So these figures are totally unreliable.
So it's quite complicated because you've got patients, veterans with with a lot of diagnoses really that you've got to disentangle. But can you give me just an idea, with someone with mild TBI, what would their symptoms be compared to TBI PTSD? It's the mild bit I'm trying to explore.
So they would have sensitivity to light, they would have problems concentrating, they would have sleep disturbance, they would have anger management issues, they would have difficulty finding their words in sentences. Lots of the cases I have seen cannot even remember the process of making a cup of tea or even a sandwich. So they are the ones that struggle massively daily to be able to function on any level. Equally, we know that PTSD comes partly as this diagnosis, given the incidents that they were involved with that caused the PTSD. So those overlapping symptoms, one will trigger the other. So they live in this absolutely abyss of hell with these symptoms daily, with real problems trying to function. And of course, their symptoms manifest even further and their condition gets worse and worse.
These are the people that are probably out in our communities that are not seeking or looking for help or getting help.
Well, these are the individuals looking at the large amount of cases now that I have collected, well over 1,000 now of these cases. They've all seemed to follow the same pattern. So they have been prematurely discharged from the military without any level of assessment, even though they were displaying these symptoms. Or they've been misdiagnosed, which has led to mistreatment. And they have remained in these services, psychological services, being labelled with, as you just said, all sorts of disorders with inadequate treatment. Many are labelled as treatment resistant or malingerers, and they are equally discharged from these services back to their families, who are then sent beyond breaking point trying to cope, who are left with the burden of trying to cope with this. Many of the wives have had to go back to work because they can't afford to sort of stay in the family home as they were. Their husbands are not able to work. And as a result of that, equally, they have no evidence to be able to apply for their armed forces compensation. So all of the cases, I'm not going to say the majority or a minority of the large number of cases we have not been able to apply for compensation. No one has.
Okay, thanks, Mandy.